Um, Good morning, Chair Parks, Supervisors, Mr. Powers. Last week, at the end of the week, we saw that the FDA met and gave a hint that what might be coming for boosters would be individuals 65 years of age and older, but the process didn't end there. We weren't allowed to start giving boosters because more organizations need to give their okay. The Advisory Committee on Immunization Practices, the ACIP, will meet tomorrow and the day after this week. And then when they make their recommendations, assuming they do, the Western States Group will review those recommendations, and only then will new recommendations on boosters go into effect. The possible or likely booster recommendations that the ACIP have made and will be, and in the category of have made, is immunocompromised individuals 12 years of age and older. That's already in progress. That's 2% of the population in the United States, severely immunocompromised people. But the additional groups that will be added, or that will likely be added, are those over 65 years of age. And there is also consideration being given, and there's a good chance for included in boosters, healthcare workers and teachers. It's also likely that they will say that people in these groups are not eligible for vaccination until 6 months have passed since their vaccination series has been completed. So why not everybody? Well, because the available data indicates that those under 65 just don't need a booster yet. Their antibody titers are higher. It's very likely, however, that at some point in the future, everyone else will be eligible to receive a booster vaccination. And at first, it's likely that only Pfizer recipients will be able to receive the booster dose. Those in any of these groups that I just mentioned who received Moderna vaccine or the Johnson & Johnson vaccine will have to wait until those vaccines receive approval from the FDA. It's anticipated that will occur 2 to 3 weeks following the approval of the Pfizer boosters. So I don't think there's going to be a long wait. As far as vaccination for children 5 through 11 years of age, Pfizer plans on submitting its request to have that vaccination approved by the end of this month, the end of September. It's predicted to be approved by the ACIP by the end of October. The vaccine preparation for those younger than 12 years of age has about 1/3 of the amount of vaccination material in it than the current vaccines that we are giving adults. And as far as younger children go, even those as young as 6 months of age, it's possible that vaccine approval for them will occur before the end of the year or early next year. Younger children go, even though material in it than the current vaccines that we are giving adults. Younger than 12 years of age has about 1/3 of the amount of vaccination material in it than the current vaccines that we are giving adults. And as far as younger children go, even those as young as 6 months of age, it's possible that vaccine approval for them will occur before the end of the year or early next year. Those are my comments, and any questions?
Supervisor Ramirez has a question.
Yes, thank you. Thank you, Doctor. I have so many questions. I don't want to take up all the time, but now is the time to get a flu shot as well. I think I remember last week you said no one died of the flu last year. Is that right?
No one died of the flu last year, which I think is a statement about how effective masks are for preventing the transmission of influenza. And influenza is, I think, less transmissible than the variants we've been seeing recently. And so that's why the masks don't protect all of us every time. They're not perfect for some of these variants, but they seem to have been perfect.
Question. In regards to the meetings, I do know there are some meetings that are held in person. And so I was just wondering, are you thinking, is your view because of the amount of people that would be coming to our board meeting, or I'm just wanting to get some clarification?
It is the amount of people that come to a closed space, and the possibility of the increase in transmission of this very, very transmissible Delta variant.
Okay, and so my understanding, you have extended the mask ordinance for indoors, and I appreciate so much that we are able to keep our businesses and our schools still open and functioning. At what time would you be looking at reassessing that mask mandate? I know the last one was for 30 days and that you would assess it again, but I just want, if you could reiterate.
As we approach that date, and if something dramatic happens in terms of things opening up and becoming clearly presenting fewer opportunities for the transmission of disease, it could occur sooner. But I deal with this decision on a collaborative basis. Ultimately, the decision is mine, but there are a number of us at the county that talk about this, that follow the data all the time. And to say it's daily or every other day is really not inaccurate. We're constantly looking at this.
Well, I appreciate that, because the community might not understand how much our county is talking about this and how serious we are. It's not something that is stated and then we don't talk about it for 30 days. It is assessed all the time, and the public health of our community is such a high regards for us. I just really appreciate that we're still able to do our business at hand. Our kids get educated. And so I just really appreciate that. So thank you very much for everyone's hard work and to hear.
Yes, thank you. Thank you, Mr. Powers. So the state recently asked us to consider the same question, and a number of options were presented to us. I'm strongly recommending for our county social distancing measures continue to be practiced at meetings of the Board of Supervisors to minimize the spread of COVID-19 in our county. Remote board meetings provide an excellent solution which allows for participation of the community, county staff, presenters, and board members in a safe environment with no risk of contagion. It's recommended that the board implement 100%, I recommend 100% remote meetings. We will continue to evaluate this on a frequent basis.
Thank you, Dr. Levin. And just, decisions very data-driven. We do want to just remind folks, too, that there is really good access to the board meetings. I think we see more participation than ever through Zoom, through remote participation, emails, and a reminder that the building is open, county building open 3 days per week, Monday, Wednesday, Friday. And again, as Dr. Levin is alluding to, though the governor's order expires at the end of this month, there is a new law, AB 361, that will be moving forward under to continue to hold remote meetings in October, but continue to evaluate, as I say, daily, weekly, monthly. Thank you.
And thank you, Dr. Levin. Thank you, Mr. Powers.